Hi, Michelle.
Hi,
How are you?
I'm fine.
Uh, I'm Patrick Nyonzimo. I would like to ask you some question about global health.
Yes.
Global health seems to be in the news more and more in recent years. Talk about what global health is and why it's important to pay attention to it.
Yes, thank you so much. My name is Michelle Nijana. First, I'm starting to talk about health. Health is a state of complete physical, mental, and social well-being, and not simply the absence of disease in the human body.
Yes.
With that, the health face different issues such as disease, virus, and epidemics. Those issues travel from country to another. After that, it become a world problem and global issue. As the question said about the global health is an area for study, research, and practice where a priority on improving health and attaining fairness in health for all people all over the world. According to the resource written by Daniel Sedmak, which is have the title Global Health, is where you can find more information about global health. As it's important, it is important to pay attention for global health for these reasons. It helps in monitoring and evaluating health status and health condition throughout the world. It helps also to gather information and try to inform and educate and empower not only countries but also communities and individuals. It is important to change of creating in fact structure in which a better health can take place. It helps on creating and mobilizing partnership between the government and non-government organization in the way of mobilized community and improve healthcare. Next, helps in improving information to guide policies, laws, and regulation in order to ensure adequate health care coverage. It works while people do more research and innovation, whereby they focus on understanding the problem and innovating the new solution. It helps in the way where people found the way of implement new strategies and the best practice to find the best way to intervene the improvement of health. Uh, According again to the resource written by Dr. David Ball, which is called Wise Global Health is Important, you can just find other more information.
Oh, thank you very much. Then, second, disease can come to us in different ways. Explain the difference between communicable and non-communicable disease.
Yeah, thank you so much. About the difference between communicable and non-communicable disease. Communicable disease are those diseases that spread by contact with something or that contain a germ and include disease. Example of communicable disease can be HIV/AIDS, influenza, malaria, and tuberculosis. For non-communicable disease are those disease that is not transmissible directly from person to another. Example of those disease you can find the cancer, lungs, heart disease, and other non-communicable.
Thank you.
Yes.
Then, to prevent or at least lessen the chance of getting Ebola. I mean, let's talk about Ebola. Since I'm sure most of viewers have heard a lot about that. What is it? Is it communicable or uncommunicable? How do people get it?
Yes, Ebola virus is occasional and deadly disease. This means the disease which can kill person. It commonly affecting people and non-human, which can call primates, where you can find the monkey and the gorillas and chimpanzee. It is caused by an infection which with a group of viruses within the genus called Ebola viruses. It is a communicable disease because it transmits between one person to another, even animal to another animal. People get Ebola among humans only through direct with the blood or bodily fluid, such as saliva and mucus, on infected person or by touching objects like needles. The person who has been in contact with that virus. You can find more on the resource which is called What is Ebola Virus Disease.
Then, what raise a person risk of getting Ebola?
People are at risk only if one person have traveled to an area where an outbreak is going on. Also, a person is at risk when he had contact with a person infected with the Ebola virus. Then, when a person is cared for someone who is infected, it can also occur when the physicians are not organized well and when they haven't enough material to care for the infected person.
Then, so to prevent or at least lessen the chance of getting Ebola,
Yes.
what should the people do?
Yes, people should avoid contact with blood and other body fluids, such as urine, feces, saliva, sweat, vomit, breast milk, and semen, and vaginal fluid. People should also avoid contact with an infected person, such as items like clothes, bedding, needle, and medical equipment. The died person with Ebola virus, in terms of barrier and funeral, people should avoid touching on the body. People also should avoid contacting with a bat, which is like the animal, and to their blood and the body fluid from those animals which are died. People should also avoid traveling from the area where the outbreak took place. Thank you.
Then, outbreaks such as the one related to Ebola can generate a lot of rumors and misinformation and even panic about what this is, how it is transmitted, and how likely people are to take it. Talk about the need for educating people about facts versus myths.
Yeah, thank you so much. I start on the myth. You cannot contact the virus from a deceased person. This is a myth. Ebola virus is airborne. This is also another myth. Ebola virus is not sexual transmitted. A person who has recovered from Ebola virus is still infected and can spread the disease. Also, this is additional myths the person think or have. There is a cure to Ebola virus. Last myth, people can get vaccinated against Ebola. As the factor, after a person dies, the body remains contagious. The virus is spread through bodily fluid. It is not airborne. Ebola virus is passed through the exchange of bodily fluid. Only people showing Ebola symptoms currently can pass on the virus through casual contact. No cure has yet been found. There are currently no licensed Ebola vaccine, but two potential candidates are undergoing evaluation. That's more you can find on the resource which is written by Limpcott Solution, which is called Ebola Myths and the Facts. Thank you.
Thank you. Now having another question. How about the complication that Ebola raises for the rights of travelers and the responsibility of governments? Archie Cook, for example, and asked for men who returned to the States following a trip to West Africa in the fall of 2014, promptly had quarantine-related restriction thrust upon her, restriction that she was very much against. Briefly describe the difficulty of balancing individual rights and governmental responsibility.
Oh, thank you so much. For sure, Ebola raises some complication for the right of travelers and the responsibility of the government. Every traveler has the right of traveling in a country he or she desire to go. Unfortunately, some countries are facing the outbreak of Ebola, like where Cassie Hicks was coming from. Individuals have the right of traveling from a country to another. However, the government's responsibility is to protect public health and individual rights, where they balancing the complication of Ebola between government and the patient. For sure, it requires careful balance. The court should use the medical experts who are able to accomplish the goal of protecting public health. With this, while deciding to put someone else in quarantine, there should be a sufficient evidence to support that action. Also, in order to get a well-ordered society, the government and the Supreme Court must be able to enforce reasonable regulation in responding to epidemic disease, which support the safety of its individual. For example, when there are reasonable regulation in responding to epidemic disease like Ebola, Kechi Hickson, her situation shouldn't raise to that level, which seems as to violate her right. Thank you.
Thank you. Then let's talk about smoking and tobacco use, which is considered a big world health problem and raises similar issues to Ebola in terms of rights and responsibilities. Just about everyone knows that smoking harms health. What does it do to the body?
Yes, smoking and tobacco use can cause some disease to human body, such as cancer, heart disease, stroke, lungs disease, and diabetes, and chronic obstructive pulmonary disease. Smoking also increases the risk for tuberculosis, certain AIDS disease, and the problem of immune system, which including rheumatoid arthritis.
Thank you. Then, what about second-hand smoke? Explain what that is and how it affects people.
Yeah, thank you so much. The second-hand smoke are those people who are exposed to someone else who are smoking, and those people most of the time are absorbed the smoke via pulmonary way. The second-hand smoker considered as someone who smoke with that way. With that, many hand smokers are attacked with some disease which caused by the second hand smoke, like stroke, lung cancer, and coronary heart disease in adults. Also, for the children who are exposed to second smoke are at increased risk for suddenly infant death syndrome, acute respiratory infection, middle ear disease, more severe asthma, respiratory symptom, and slow lungs growth. According to the resource which is called the health effect, you can find more information.
Oh, that's fine. Then people don't typically think of tobacco as drug like heroin or cocaine. But the addiction it creates is strong, isn't it? Uh, should we think of tobacco use as a form of substance use?
Yeah, many people who use tobacco as drug are addicted with that. Tobacco contains more substances like nicotine. It contributes as an addiction when a cigarette smoker enter the lungs. Nicotine is absorbed rapidly in the blood and delivered quickly to the brain, so that nicotine level peak within 10 seconds for inhalation. Along with the association of feelings of reward, it becomes a rapid cycle which causes the smoker to continue dosing to maintain the drug pleasurable. The effect of being addicted A smoker thinks that cannot live without using tobacco, and these effects appear on his long life period, such as irritability, craving, depression, anxiety, cognitive and attention deficit, sleep disturbance, and increased appetite, cognition problems. Those effects appear within a few hours after the last cigarette was taken. Thank you so much. You can find more information on the resource written by Institution of Drug Abuse, which is called Is Nicotine Addictive?
Oh, thank you for talking to us.
Thank you so much.